She was 34 years old. She taught yoga 5 mornings a week at a studio in downtown Austin. She meditated every morning, ate organic, never smoked, drank maybe 1 glass of wine on a Friday night. She was, by every measure, the picture of health. And on a Tuesday morning in March, 3 weeks before her 35th birthday, she collapsed in the middle of her 9 a.m. vinyasa class. Her students watched her knees buckle. They thought she was demonstrating a new balance pose at first. Then she hit the floor and didn't move. By the time the ambulance arrived, her heart rate had dropped to 38 beats per minute. Her blood pressure was barely 70/40. They put her in the back of that ambulance, not knowing if she would survive the drive to the hospital. I'm Dr. Alan Mandel, and in my 40 years of clinical practice, I've seen cases like this more times than I can count. And what's even more shocking is that this woman's story, her collapse, her crisis, her diagnosis, it was almost entirely preventable. Today, I'm going to walk you through exactly what happened to this beautiful young woman, what the doctors discovered in the emergency room, what the hidden vitamin deficiency was that nobody caught until it nearly killed her, and most importantly, how you can make sure this never happens to you or someone you love. Stay with me all the way to the end, my friend, because what I'm about to share with you could literally save your life. This is one of those stories that keeps me up at night because I know there are millions of people watching right now who have no idea they're at risk. Let me tell you about Sarah. That's not her real name, but I've changed the details to protect her privacy. Sarah came to see me about 6 months after her collapse. She was referred by her cardiologist, who knew something was wrong but couldn't figure out what was causing it. Sarah was a client of mine, actually. She'd been coming to me for adjustments for about 2 years. She was a dedicated yoga practitioner, ate incredibly clean, was never sick, never had any health complaints whatsoever. And then one morning in March, she woke up and felt a little off. Not terrible, just a little bit tired, a little lightheaded. She thought maybe she hadn't slept well. She went to teach her class anyway because that's what she always did. She started the warm-up sequence, moved into sun salutations, and then everything went dark. She doesn't remember collapsing. She doesn't remember her students screaming. She doesn't remember the paramedics cutting open her yoga pants to attach the heart monitor. She woke up 3 days later in the intensive care unit with a tube down her throat and her husband crying at her bedside. The doctors told her she had experienced a severe cardiac event. Her heart had basically stopped responding normally to electrical signals. They called it a complete heart block with severe bradycardia. In English, that means her heart was beating so slowly and so irregularly that it couldn't pump blood effectively to her brain and organs. They told her husband to prepare for the worst. And Sarah, who had spent the last decade taking perfect care of her body, who had never smoked a single cigarette, who had never touched a processed food in her life, was sitting in a hospital bed at 34 years old wondering why her heart had suddenly decided to fail. Now, here's what makes this story absolutely remarkable. When the doctors ran their tests in the emergency room, they checked everything. They did an echocardiogram, that's an ultrasound of the heart. They did cardiac catheterization. They ran blood panels, checked her electrolytes, checked her thyroid, checked her kidney function. They did MRI scans of her brain. They did everything you could possibly imagine. And you know what they found? Nothing. No blockage in her arteries, no structural damage to her heart, no tumor, no infection, no obvious cause. The cardiologist actually said to her husband, "I have no explanation for why this happened." And that's when the real detective work began, because Sarah's story is not unique. I've seen this exact presentation more times than I can count over my 40 years in practice. A young, healthy person who suddenly collapses with a cardiac event that should not have happened given their age and their health status. And almost every single time, the underlying cause is something that standard blood tests routinely miss. Let me explain what happened to Sarah and what you need to know to protect yourself. After the initial crisis stabilized, Sarah was transferred to the cardiology floor for observation. The doctors were monitoring her heart rhythm around the clock, and while they were watching, they noticed something very unusual. Her heart rate would oscillate wildly. It would drop down to 35 beats per minute, and then suddenly spike to 120 beats per minute, and then drop again. This pattern, this up and down erratic behavior, told the doctors that something was disrupting the electrical conduction system of her heart. And that's when someone on the medical team ordered a very specific test that most general practitioners never think to run. They checked her vitamin B12 level, and when the results came back, the entire medical team was stunned. Sarah's vitamin B12 level was 89 picograms per milliliter. Let me put that number in context for you. The standard reference range for B12 in most labs is 200 to 900 picograms per milliliter. Anything above 200 is considered normal. Anything below 200 is considered deficient. Sarah was at 89, less than half the bottom of the reference range. And here's what makes this absolutely critical. Her regular doctor, the one she had been seeing for annual checkups for the past 5 years, had never once checked her B12 level. Not once. Because most doctors only check B12 if a patient has obvious symptoms of deficiency, like numbness in the hands and feet, or difficulty walking, or obvious signs of anemia. But Sarah had none of those classic symptoms. She was tired sometimes, but she attributed that to teaching 5 classes a week. She occasionally felt a little lightheaded, but again, she blamed it on not sleeping well or being dehydrated. She never had the textbook symptoms that would trigger a doctor to run the test. And because of that, she had been slowly, silently, progressively depleting her body of one of the most essential nutrients for neurological and cardiovascular health for years. Now let me explain exactly why vitamin B12 deficiency causes the kind of cardiac event that Sarah experienced, because this is the part that most people, and even most doctors, don't fully understand. Vitamin B12 is essential for something called myelin formation. Myelin is the protective sheath that surrounds your nerve fibers. Without adequate B12, the myelin starts to break down. And when the myelin in your heart's electrical conduction system starts to deteriorate, the electrical signals that coordinate your heartbeat start to misfire. They travel too slowly. They get disrupted. They short circuit. And that manifests as exactly what Sarah experienced. Dangerous arrhythmias, bradycardia, heart block, and in severe cases, complete cardiac arrest. This is why I want you to pay very close attention to what I'm about to say. Vitamin B12 deficiency does not announce itself loudly. It doesn't walk into your life wearing a warning sign. It creeps in slowly, year by year, decade by decade, often without producing any symptoms that would prompt a doctor to run the test. You feel a little tired? You blame it on your busy life. You feel a little foggy? You blame it on stress. Your hands tingle sometimes. You blame it on sleeping on your arm wrong. And your doctor, operating with a 15-minute appointment window and 50 other patients to see, follows a standard protocol that only flags obvious B12 deficiency. So millions of people are walking around right now with marginal or even significant B12 deficiency, levels that are technically within the reference range, but well below what's needed for optimal neurological and cardiovascular function. And they have no idea. The research backs this up completely. A 2019 study published in the journal Mayo Clinic Proceedings found that up to 20% of adults over age 60 have B12 levels low enough to cause neurological symptoms, and many of them never get diagnosed. The National Institutes of Health has stated publicly that B12 deficiency is significantly underdiagnosed in the general population, and a 2021 review in the American Journal of Medicine highlighted the exact phenomenon that happened to Sarah. Cardiac arrhythmias and conduction abnormalities directly linked to severe B12 deficiency, often in young, otherwise healthy individuals. So how did Sarah end up with such a critically low B12 level? This is the part that will make you rethink everything you thought you knew about healthy living. Sarah was a vegan. She had been a vegan for 7 years. She did not eat any animal products whatsoever. No meat, no dairy, no eggs, no fish. She ate an incredibly clean diet. Organic vegetables, whole grains, legumes, nuts, seeds, lots of fruits. She was doing everything right in terms of the mainstream health narrative. But here's what most people don't realize. Vitamin B12 is found almost exclusively in animal products. There is no reliable plant-based source of B12. Yes, there are some fermented foods and certain algae products that contain B12 analogs, but these are not bioavailable. Your body cannot use them effectively. The only truly reliable source sources of absorbable B12 are animal products, meat, fish, dairy, and eggs. This is why vegan athletes, vegan yoga teachers, vegan health enthusiasts, and anyone following a strict plant-based diet without supplementation is walking a very thin line with their B12 status. Now, I want to be very clear about something. I'm not here to tell you that a vegan diet is inherently bad or wrong. Many people thrive on plant-based eating. But I am here to tell you that if you are vegan or vegetarian and you are not supplementing with B12, you are playing Russian roulette with your neurological and cardiovascular health. And Sarah didn't know this. Nobody had ever told her. Her primary care doctor didn't mention it. Her nutritionist didn't mention it. She had read countless articles about the benefits of a plant-based diet, but she had never seen one article that talked about the absolute necessity of B12 supplementation for anyone who doesn't eat animal products. And by the time she came to see me 6 months after her cardiac event, she had been vegan for 7 years without ever taking a B12 supplement. Her body had been slowly depleting its B12 reserves for 7 years, and it had finally hit a crisis point. Now, here's something else that most people don't understand about B12. It's not just vegans who are at risk. Let me walk you through the full list of people who are vulnerable to B12 deficiency, because you need to know if you fall into any of these categories. The first group, and the one most people know about, is strict vegans and vegetarians. If you don't eat animal products, you need to supplement. Period. Full stop. That's not a suggestion, it's a medical necessity. The second group is people over age 60. As we age, our ability to absorb B12 from food declines significantly. Stomach acid production decreases, and we lose the intrinsic factor cells that are necessary for B12 absorption. Research from Johns Hopkins Medicine indicates that up to 30% of older adults have some degree of B12 malabsorption. The third group is people with digestive disorders, things like Crohn's disease, celiac disease, irritable bowel syndrome, or anyone who has had gastric surgery. These conditions affect the lining of the stomach and small intestine, where B12 absorption takes place. The fourth group is people who take certain medications. Proton pump inhibitors, drugs like Prilosec, Nexium, and Prevacid, reduce stomach acid, and low stomach acid means reduced B12 absorption. Metformin, the common diabetes medication, has also been shown in multiple studies to deplete B12 levels over time. And the fifth group, and this is one that surprises a lot of people, is people who drink alcohol regularly. Even moderate alcohol consumption over extended periods can damage the stomach lining and impair B12 absorption. So if you are a vegan, if you are over 60, if you have any digestive issues, if you take acid reflux medication or metformin, or if you drink alcohol regularly, you need to pay very close attention to your B12 status. Now let me talk about something else that contributed to Sarah's situation. And this is a factor that many health-conscious people don't consider. Sarah was taking a daily multivitamin. She had been taking the same brand for years. One of those premium, whole food, organic multivitamins from a health food store, and she assumed that because she was taking this supplement, she was covering her nutritional bases. But here's what most people don't understand about B12 in supplement form. The form of B12 that's most commonly used in supplements is cyanocobalamin. While cyanocobalamin is stable and inexpensive, it's actually the least bioavailable form of B12, meaning your body has a harder time absorbing and using it. The better forms, the ones I recommend to my patients, are methylcobalamin and adenosylcobalamin. These are the forms that your body can use immediately without needing to convert them first. And even then, many people, particularly those with MTHFR gene variations, which affects an estimated 30 to 40% of the population, have trouble converting standard B12 supplements into the active forms their bodies need. Sarah was taking a supplement that contained cyanocobalamin - the least absorbable form - and she was doing it thinking she was protecting herself when she was barely making a dent in her deficit. This is why I want you to pay very close attention to this next part. If you have any of the risk factors I just mentioned, vegan diet, age over 60, digestive issues, medication use, regular alcohol consumption, you need to be proactive about your B12 status. And I'm going to tell you exactly what to do. First, ask your doctor to run a B12 blood test. Not just the standard panel dash specifically request B12, along with methylmalonic acid and homocysteine, which are more sensitive markers of B12 status that can catch marginal deficiency before it becomes severe. MMA and homocysteine both tend to be elevated when B12 is low, even if the B12 level itself appears normal on the basic test. Second, if you are vegan or vegetarian, you need to supplement with B12 every single day. And I'm not talking about a multivitamin. I'm talking about a dedicated B12 supplement with at least 500 micrograms of methylcobalamin or adenosylcobalamin. Talk to your doctor about the right dose for your situation, but for most adults, 500 to 1,000 micrograms daily is a reasonable starting point. Third, if you are over 60 or have any malabsorption issues, consider getting your B12 levels checked annually, not just every few years. And talk to your doctor about whether sublingual B12 drops that go under your tongue might be better for you than oral supplements, since sublingual B12 bypasses some of the digestive absorption issues that can plague older adults. Fourth, pay attention to your body. And I want you to do this with me right now. I want you to stop and think about whether you've experienced any of the following symptoms over the past several months. Chronic fatigue that doesn't improve with rest, persistent brain fog or difficulty concentrating, numbness or tingling in your hands or feet, difficulty with balance or coordination, mood changes, things like increased anxiety, depression, or irritability, pale or sallow skin, heart palpitations or a sensation that your heart is racing or stumbling, shortness of breath with minimal exertion. If you recognize 2 or 3 of these symptoms and you fall into one of the risk categories I mentioned, please, I'm begging you, get your B12 level checked. Do not wait. Do not assume it's nothing. Do not tell yourself it will go away. Sarah was experiencing many of these symptoms in the months before her collapse, and she attributed all of them to her busy schedule and the stress of running her yoga business. Her cardiologist later told her that if she had come in 6 months earlier, had someone run the right test, had someone identified the deficiency, they could have reversed all of the damage. Her heart had suffered, her nervous system had suffered, and while most of it did heal once she started treatment, some of it may be permanent. This did not have to happen. Now, after Sarah's diagnosis, the medical team started her on high-dose B12 supplementation immediately. They used both intramuscular injections because at her level of deficiency, oral supplementation alone wouldn't be sufficient, and high-dose oral methylcobalamin. Within 3 weeks, her heart rhythm stabilized. Within 6 weeks, the worst of her neurological symptoms started to improve. Within 3 months, her repeat testing showed marked improvement in all her markers. She was able to return to teaching, but with a very different understanding of what it means to take care of your body. She started eating fish and eggs again. She took her B12 supplements religiously. And she became an advocate for B12 awareness in the vegan and health community because she didn't want anyone else to go through what she went through. Let me bring this home for you, my friend. This story, Sarah's story, is not rare. It's not a 1 in a million fluke. I've seen it in my practice. Other doctors have seen it. The medical literature documents it. B12 deficiency causes real, measurable, sometimes catastrophic damage to the heart and nervous system. And it is going undiagnosed in millions of people right now. The standard blood test is not sufficient. Most doctors are not trained to catch it in its early stages. And the symptoms and the early warning signs are so vague and so easy to dismiss that most people will ignore them until something serious happens. But you don't have to be one of those people. You can be proactive. You can be informed. You can ask for the right tests, take the right supplements, and make the dietary choices that support your long-term neurological and cardiovascular health. This is why I make videos like this. This is why I share these stories. Because knowledge saves lives. And if just one person watching this video gets their B12 level checked, if just one person recognizes their own symptoms and gets them evaluated, if just one person avoids the kind of crisis that Sarah went through, then this was worth every minute of your time and every word of this script. If this video resonated with you, if you learned something that you think could help someone you love, please share it. Send it to your mother, your sister, your best friend. Send it to the people in your life who are vegan or vegetarian. Send it to anyone over 60 who takes medication. Send it to anyone who you know has been feeling tired and foggy and just doesn't know why. You might save a life today. And if you want to learn more about the connection between nutritional deficiencies and chronic health conditions, I have another video that I think you'll find incredibly valuable. It's linked right here and also in the description below. I also want to encourage you to subscribe to this channel if you haven't already, because I post new content every week and I'm committed to bringing you the most practical, evidence-based health information that I possibly can. Remember this, my friend, your body is always talking to you. Always. Every symptom, every ache, every twinge, every wave of fatigue, it's all communication. You just have to learn how to listen. And the first step is being informed. Be your own best advocate. Ask the questions, request the tests. Don't settle for everything looks fine if you know inside that something isn't right. Your health is your most precious asset. Protect it with everything you have. I'm Dr. Alan Mandel, wishing you incredible health, and I'll see you in the next video. Take care of yourself and take care of each other.